we're going to continue with policies in long-term care facilities. During the height of the COVID-19, the Center for Medicare and Medicaid enacted some policies. Also, the CDC enacted some policies for the long-term care facilities. So the objectives for these slides coming up will be to outline the COVID-19 guidelines for nursing home, will be to recognize the impact of COVID-19 in long-term health facilities, to recognize the Center for Medicare and Medicaid COVID-19 procedures for nursing homes. So this is just some data from the Kaiser Family Foundation. The takeaway from this slide is just to show that over 38% of COVID deaths in January 2020 were in long-term care facility. So the long-term care facilities were hard hit by this disease. So we're going to continue with COVID-19 policies in nursing homes. So the nursing home residents are at high risk for COVID-19. And why is this so? This is due to the congregate nature of the nursing homes. Elderly in the nursing homes, they have multiple comorbidities, and they are on many medications. They have multi-drug resistant organisms also. Elderly also have depressed immunity. That's why they are hard hit by COVID-19. So the CDC recommends that an infection prevention and control program be instated in the nursing homes. And this program, what this program does is to develop policies and procedures for the nursing homes to against COVID-19. This program also is to perform infection surveillance, providing competency-based training to the healthcare professionals. And this program also makes sure that both the healthcare professionals and the nursing home residents, they abide to these recommendations. So continuing with the nursing home policies in COVID-19, this is just the Center for Medicare and Medicaid policies that were enacted during the height of the COVID pandemic. So there was one for nursing home visitation. There was one policy for nursing home visitation, and there was another policy for infectious control. The policy for nursing home visitation was to restrict visitation of non-essential workers, except in end-of-life situations. So the policy was also to screen the privileged visitors, like the clergy, the bereavement counselors, etc. And also, the permitted visitors were to adhere to preventive protocols. So the infectious control policy was to make sure that the facility tests their residents and their staff and their volunteers in the event of any suspected disease. So this is just continuing with the policies of COVID-19 in long-term care facilities. This is just a diagram showing how testing was to be done in the facilities. In the event that a symptomatic individual was identified, the staff with signs and symptoms must be tested, and the residents also with signs and symptoms must also be tested. In the event of an outbreak in the facility, all staff who were previously negative were to be tested, and all residents, even those who were previously negative, were to be tested. And there was no routine for routine testing. There was no recommendation for routine testing unless the resident leaves the facility and comes back. Then the resident needs to be tested. So this is the end of the slides. This concludes my presentation. Thank you very much for your attention.